How to score the ASQ3. We will cover all of the information needed to score the Ages and Stages Questionnaire, 3rd edition, determining which age screen to use, how to prepare for scoring, how to score each domain and dealing with missing items, as well as where you can find more information about the ASQ3 and general development screening. The ASQ3 is a parent-completed general development screen. ASQ3 has reliable screens from age 2 months to 60 months or 5 years. Indeed, there are 21 different screens available, including the 3 screens recommended by the American Academy of Pediatrics at 9 months, 18 months, and 30 months. If you are screening outside of those 3 age ranges, there are 2 ways to determine which age screen is most appropriate for the child. You can determine the appropriate screening age for children up to 2 years old by taking their chronological age and subtracting the number of weeks the child was born prematurely. ASQ has both a website and a mobile app that includes this ASQ age calculator. Once you have determined which age screen is appropriate for the child, it is important to be ready for scoring. This means double-checking that you have the correct age form. It also means checking in with the parent or caregiver in their comfort with reading the screen. The ASQ3 comes in 6 common languages: English, Spanish, French, Vietnamese, Chinese, and Arabic. Remember to provide reading assistance if needed. The ASQ3 includes an overall questions section. It is important to note that this section is not scored and asks caregivers to reflect on the quality of the child's skills and development. Be sure to read responses in this section, as caregiver concerns are often predictive of the ratings parents give, and all concerns and questions deserve and require follow-up. Now that you are ready to score the ASQ3, let's dive in on how to score each domain. Next to each item, there is a space to write a score. For caregivers whose response is that the child does not do the milestone yet, or not yet, the score is 0. For the answer sometimes, the score is 5. For the answer yes, the score is 10. Write these corresponding values next to each item and total the score for each of the 5 domains. You will then copy these domain totals onto the summary sheet. It is important to also copy over information from the overall section, including any yes/no answers or comments and concerns. Once you have the overall information also on the summary sheet, write the total scores for communication, gross motor, fine motor, problem solving, and personal social domains on the summary sheet in the total score column. Next to the total score column is a place to fill in circles that match with the potential scores for each domain, from 0 to 60. Fill in the circle that matches with the total score, and the color surrounding the circle helps provide interpretation. If the score is in the area with black surrounding the circle, it means that further assessment is needed. If the score is in the area with gray surrounding the circle, this is when ASQ3 recommends providing the ASQ learning activities for the age and actively monitoring progress on these developmental milestones. If the score is in the area with white surrounding the circle, this means that development is on track and there is not a current concern in this domain. Occasionally, caregivers may skip or forget an item, leaving you with missing items on the screen. If you are with the family and the parent indicates that they did not answer because they were unsure of whether the child can do the milestone or item, and the child is well enough to test out the item, try it out in the exam room. We like to say, when in doubt, test it out. However, if you're scoring a screen and do not have the child and family present, make sure to use the adjusted score calculator available on the ASQ website and mobile app that will help you calculate total scores. Here is where you can find more information on the ASQ3 and general development screening. Check out the resources linked below for information on general development screening, the ASQ3, and more, including our general development training page, which is a part of the Developmental Screening Online Toolkit, the Louisiana Medicaid Bulletin on reimbursement for autism, general development, and perinatal depression screening, and the ASQ3 website, where you can find more information about purchasing the ASQ3 and trainings from the creators. You can also check out our videos on the basics of the ASQ3 and using developmental screening resource guides with families, which we recommend using when a screen indicates a need for further evaluation or services.